Right. So if we have a look at the X-ray here, on the right side, you can see there is a significant damage to your bone. There is no gap. Here the gap is more. There is a previous operation also, you said. So this is a knee joint. A good knee has got equal gap, but a bad knee has an unequal gap. And when it rubs against each other, it damages this part. When the damage is advanced, then we offer knee replacement. If you see the other X-ray, it is only inner side of the knee which is damaged. So knee has three sides: inside, outside, and one over here. So if this side and this side is very good, then we offer, if we talk about replacement surgery, then we offer a half knee replacement. So this is your side. We don't cut any ligaments. We do not cut bone as much as we cut in total knee. 20% less bone is cut in a half knee compared to the full knee. And the National Joint Registries has shown that 10-year and 15-year survival rate of a half knee is almost matching the full knee. Small cuts, faster recovery, no ligament cut, less bone cut. Now, if we talk about a full knee, as Dr. Rahul will show you, here the entire implant is put on both sides. So there are three parts. Part number one, just remove it, is this part which goes on the thigh bone. So this is a thigh bone, correct? So this part goes here like this. Part number two, which goes on the shin bone, and this is a shin bone. And when both these parts are attached together, there is a plastic part in between which keeps a gap. So he fits it here and one here like this. So this is a full knee. Even in full knee replacement, I do not cut the ligament called PCL. In this way, the science has shown that patients have a better feeling of this knee when they compare it with a natural knee. You must know that the healing time of knee is 3 to 5 months. Younger the patient, faster the healing. Older patient, slow healing. First 6 weeks are very crucial because maximum bending you can achieve is within the first 6 weeks. 6 to 12 weeks also bending will improve. But after that, there is a little chance of improvement in bending. So it is important for you to realize the role of physio, the role of decreasing the pain and swelling with certain techniques you can do, like ice pack, compression bandage, and exercise, and some medicines which I will give, like pain medicines and some enzyme preparations. I do not restrict anything after knee replacement. This is to improve your quality of life, to make you feel happier, to take away the pain, to take away the need for painkillers. So is there any question you have? Please.
Yes. I want to go to replacement to my knee.
Yeah.
How many years can stay there?
Okay. So
There's any
I wish
any day
we could say that human beings, what we put lasts for life. I wish. But everything has a life. I have a life.
Yes.
My hairs have a life. My teeth have a life. My bones have a life. So ideally speaking, a good knee replacement, if done in elderly people like 65 or 70s or even 60s, I say they should last you lifelong. Because if you see the average life expectancy of a person. But saying that knee will last for 15 to 20 years does not mean that 20 years, 1 day, 1 hour it will fail. No. Majority of the knees lasts longer than that. The cause of failure is not just the wearing of the implant. Sometimes it fails because of fracture. if you have had an accident. Sometimes the failure occurs because of infection. Sometimes the failure occurs if the implant is not put the way it is. And we cannot blame the implant. It's me who has put it. The implant has no life. It has no life. So it can be put anyway. He can put it in a different way. I can put it in a different way. But we have to choose the one best way of putting the implant. That's where there is a role of a robotic surgery. Minimal cuts, good balancing. But if you do not have robotic surgery, it does not mean that your knee will not do well. I can still promise you it will do very well. And stitches I don't put, just to make you happier, that there is no rule of cutting so that you have less pain.
How long it can take?
So one knee generally before I put the implant, after I put the implant, takes around 35 minutes. But there is another 10 to 15 minutes to close it. So I would say 45 minutes. Everything is dusted, one knee replacement. And even if I'm doing robot also, then also it takes same time, because now we have done so many, we are quicker, maybe less than that even.
How many days can I stay in hospital?
So
Operation.
So I have realized that previously patients were staying for a longer time. But as we changed our techniques of doing the surgery, smaller incisions, less soft tissue releases, not cutting the ligaments, even after second day, some patients are willing to go home. And I want to start a program where I can get them discharged same day, but I need to be able to provide care at your home also.
Okay, the other question, in India to get a treatment or something like that before I go to my
Country.
go back to my country.
So good. So basically, it takes 15 days for stitches to heal. If the pain and swelling is not there, after my experience of treating so many patients from abroad, I feel after 3 days in the hospital, maybe 7 days